Good morning. It's my pleasure to welcome you all this morning to our annual colloquium. We've been hosting this since 2015 when we started off with a community colloquium on mental health, guns, and violence. And the idea behind this event is to bring together our researchers, our students, professionals in the community, faculty, and the community to come together and have a conversation about important issues that are facing our community and our nation. The success of this has been evident. We've had every year over 200 people sign up and attend this event. Even when we started charging, people still wanted to be here and engage in the conversations that again are important. It takes a lot of people to pull off events like this, and I need to name a few. We always like to thank Panera, who donates breakfast in the morning to us, and Doctors Cynthia and Carl Hawkins, who unfortunately couldn't be here, have been financial supporters of this event from the very beginning, so we're very grateful to them. In the college, this takes an enormous amount of cooperation across a number of units. It's not just one unit that pulls this off every year. So I really want to thank the unit leaders from criminology, mental health law and policy, child and family studies, school of social work, the Florida Kids Count, and FMHI. This includes Mary Armstrong, Kathy Moore, Mike Lieber, Holly Hills, Rian Von Sels, and a number of others. And I really want to have a special shout out to Dr. Roger Peters, who has been leading the initiative and research in the College for Substance Abuse and Opioids for decades. And yes, he's really been an outstanding mentor, researcher, and leader in this area. And of course, we'd be remiss to not thank all the students and the staff in the dean's office, as well as some of the other units across the college who put in a lot of time. And so Patty Cleveland and her team do an outstanding job in organizing all this. We just show up, right? And they've been working hard for a number of months. So I also want to thank our community partners that are here today. You know, when we started this, we had maybe 3 community partners show up, and 2 of them were from the college. And this year we have 23 that are here. And I just want to take a minute and thank them and announce and say who's here. We have the Agency for Community Treatment Services, Baycare Behavioral Health, Cristalis Health, Clean Slate Centers, DACO Behavioral Health, Drug Free America Foundation, Grace Point, HCA Healthcare, Hillsborough County Anti-Drug Alliance, Kinship Children's Home Network, Moffitt Cancer Center, National Guard Counter-Drug Program in the Central Florida region, Operation PAR Incorporated, Pace Center for Girls from Hernando and Hillsborough, Rogers Behavioral Health, Sheila Freedom, Success for Kids and Families, Tampa Crossroads, Tranquil Shores, Turning Point of Tampa, 13th Judicial Court, Problem Solving Courts, 13th Judicial Public Defender's Office. That's a tremendous showing from our community, and we really appreciate that. So now I'd like to introduce Dr. Dwayne Smith, who's going to kick us off this morning. Dr. Smith is a professor, senior vice provost, and dean of the Office of Graduate Studies here at the University of South Florida. He came to USF in 2000 as chair of the Department of Criminology. He was named vice provost for faculty and program development at USF in 2005 and appointed senior vice provost in 2008. So basically means he's held every office in the university. His responsibilities were also expanded to include Dean of the Office of Graduate Studies, and he's going to lead us this morning in getting our program kicked off. Thank you very much.
Thank you, Dean Surovich, for that. And good morning, everyone. I'm very pleased to bring you greetings this morning from the offices of the President, Dr. Judy Genshaft, the Provost and Executive Vice President, Ralph Wilcox, and the Senior Vice President for USF Health, Dr. Charles Lockwood. We're very pleased to have you with us this morning to consider this very important topic. This has been A very interesting year, a very exciting year for the University of South Florida. Just to name a few things, number one, earlier this year we were named as a preeminent research university in the state system of Florida, something we've been striving for several years. And only a couple of months later, we were named to host a chapter of Phi Beta Kappa, a very prestigious organization. Literally, we have pursued having a chapter here for almost 30 years. But wait, there's more. We were also achieved our highest ranking in U.S. News & World Report for public institutions this year, and in an international ranking system provided by the Times Higher Education publication. We're actually ranked among institutions in the United States who have been founded since the end of World War II. We're number 6, and in the world, we were number 38. So, an impressive set of accomplishments for a university clearly on the ascendancy. But, despite all those accomplishments, we have never forget the fact that as a public institution, and especially one in a metropolitan area like the Tampa Bay region, we have a responsibility and indeed a mission to provide outreach services for community engagement and ultimately to try to make both social and psychological lives of our residents better in some ways. And so this morning's event represents, I think, one of those efforts, but the fact is there are hundreds of those every year, many of which emanate from my home college of Behavioral and Community Sciences. So we're very pleased to host this very important event this morning. The opioid crisis is one that sort of snuck up on us, if you will, somewhat silently, sort of slowly, and then burst onto the national scene with a force that we become very cognizant of as having impacted and in many cases wrecked the lives of many people across all social strata of the United States. So it'd be particularly interesting, I think, for those in attendance to hear different perspectives on this crisis, what it's about, and what we can do with it. To moderate this event this morning will be Dr. Kimberly Johnson. She is a research associate professor in the Department of Mental Health and Policy at USF. In addition to her research and teaching duties, Dr. Johnson serves as the executive director of the International Consortium of Universities for Drug Demand Reduction, a newly formed international membership organization for universities with addiction studies programs. Dr. Johnson earned her PhD in population health from the University of Wisconsin at Madison, and she has received funding from various organizations to study a variety of topics having to do with addiction, addiction studies, and addiction treatment. Her interest in the intersection of research and quality improvement has led her to use large data sets to identify targets for improvement at the system, provider organization, and individual patient levels. Dr. Johnson's dedication and contributions to the behavioral health field earned her numerous awards, and she is a highly regarded thought leader. She has authored a variety of publications on topics important to addiction and recovery that are especially relevant to today's events. Ladies and gentlemen, it is my pleasure to introduce, as our moderator, an individual who we would have been hard-pressed to find a more distinguished and appropriate individual for this event, Dr. Kimberly Johnson.
I made a mistake of wearing heels. Hopefully I won't regret that. I want to say how pleased and proud I am to be here as part of the USF community. I've only been here since May. I came by way of Maryland, and as you heard, I've also lived in Wisconsin and Maine, so I think I've come to the right place now. I've moved in the right direction. Florida is, I think in many ways, Florida as a state is a canary in the coal mine with this opioid epidemic. Florida was one of the early states with the pill mills and the misuse of prescription opioids, and was one of the earlier states that kind of moved to heroin. And I think now we're seeing the next phase, and Florida again is one of the early states where this is happening, and then we saw the move to fentanyl, and now what we're seeing is fentanyl being put into cocaine and into methamphetamine. So we're seeing that people that maybe don't necessarily meet the diagnostic criteria for having an opioid use disorder are also having opioid deaths. And so I think this discussion today, these presentations and this discussion is incredibly important for Florida, but really for the whole country. And I think that here we can be leaders in what to do and how to address the issues.